Hello, my name is Lisette Rodriguez. I am the nurse manager and nurse leader for this program. This is our UCC telehealth program, and today I'm going to talk to you about how this program will allow for increased access to care and put you in contact, or actually put patients in contact with a provider in minutes. The objective for the development of the UCC telehealth program is to focus on fast-track patients in the emergency room or urgent care setting to improve access to care, increase patient satisfaction, improve patient outcomes, decrease hospitalization, readmission rates, and decrease patient wait times. As an experienced emergency room and urgent care nurse, historically I have seen patients not be seen on the order of arrival, but rather on the severity of symptoms. This causing fast-track patients waiting to be seen for upwards of 4 to 6 hours. Therefore, implementing a telehealth program designed to only address fast-track patient needs, such as prescription refills, coughs, simple cold and flu symptoms, we can definitely decrease the overall patient dissatisfier, which is increased wait times. Key considerations should be assessed and evaluated prior to the implementation of any business plan. For this business scenario, areas of focus that were examined included leadership's involvement, technology and infrastructure, policy, licensure and credentialing, privacy and security, and of course, marketing. Areas of focus or key considerations can be brought to light through the utilization of a needs assessment. A SWOT analysis is one tool that can be used to determine if this need is present and can offer a business plan, drive, and potential. Leadership engagement is vital to the success of a plan. When the team feels that their leader is engaged, they become receptive and align with organizational goals. Resistance to change must be addressed, and a plan of action must be created to determine if this hurdle could be overcome. And we did exactly that. By having a plan of action to tackle resistance, this threat can reduce the time placed on efforts to implement change. The current state of technology and infrastructure is the basis for a telehealth program, and this must be of top priority for implementation. Furthermore, vendor selection should have a needs assessment of its own and should be tailored to the needs of the program. Reimbursement assessment and working with payers to establish pay practices must be taken into consideration to determine if profitability is likely. Licensure and credentialing needs, as well as state and cross-country requirements, must be evaluated and be obtained prior to implementation of the program, which we also did. Without the appropriate credentialing, this program cannot get off the ground. Ensuring that security and privacy concerns have been addressed and established is crucial, as they stipulate the conditions under which an electronic health record can be accessed, by whom and when, making HIPAA compliance and data security even more important than ever before. And finally, marketing is a key consideration in the adoption of a telehealth program. Once the need and demand is established, a target audience can be solicited through news, media, brochures, and networking. When looking at an overall picture of our proposed budget, we decided to include a detailed income statement in which we included annual funding of $200,000, which we accrued monthly. Our anticipated monthly revenue through Medicare, Medicaid, self-pay, and private insurers. We also included our operating expenses, including medical and office supplies, professional services, and marketing expenses. We also looked at our capital purchases, and we included our annual net income of $619,280.67. Additionally, we included our projected net earnings after June 30th of 2019 with the loss of our annual funding startup rate of $419,280.67 as our potential earnings. When detailing our anticipated revenue, we looked at our Medicare, Medicaid, self-pay, and privately paid insured patients. And when we looked at Medicare, for example, each telehealth visit was $72.70 per our national standard using a certain CPT code. When accounting for 150 Medicare patients per month that we would see, that would be a net earnings of $10,905. This money is now our expected revenue for this patient bracket. When looking at our operating expenses, we concluded that we needed to have 2 PAs, 2 RNs, 1 medical receptionist slash medical assistant on staff. These team members would be brought on board as a zero.5 FTE. The goal for employing 5 part-time employees is to avoid the additional cost of vacation, sick time, and providing medical insurance. We also noted that the cost for our operation will be a deficit of $25,282.91, which is the cost of employing 5 persons per month. Other expenses associated with our costs are the use of professional services to manage our technology, medical and office supplies, and of course, marketing expenses. Because technology can be costly and difficult to manage for an in-organization information technology department, we considered a fully managed telehealth solutions to be available to us for anticipated issues. The monthly cost for IT services was $2,389. In addition, our monthly costs for office supplies and medical supplies were $840. Our top marketing expenses included websites, newsletters, brochures, press release, and social media was a monthly cost of $1,550. Our capital purchases were analyzed and defined by any purchase that was above $500 per month. The first purchase was Capital One telehealth software, which included e-visits, medical billing, virtual waiting rooms, and online prescriptions. The cost for this software was $249 per user, which equated to $45 per month. A Capital 2 expense was our telehealth hardware, which was a one-time purchase of $25,000. This number was broken down into 12 installments per year, leaving a monthly cost of $2,083. Lastly, our third capital expense was computer maintenance and upgrades, which was a monthly cost of $550. This service would include online support, remote server maintenance, and monitoring. When looking at our overall cost, I am in hopes that after my brief explanation of our proposed budget, you too will see how profitable our business venture can be, with a approximate net earnings of $419,000 without the additional initial startup funding. After 1 year that this program has been established, the expected revenue resources that we would venture into would include federal and state grants, optimization of billing, attraction and retainment of patients through other avenues, competing with local clinics, reducing no-show payer contracting, increased patient volume, and creating revenue for existing patients. Federal and state grants can be subsidized costs, but telehealth programs must be appropriately sized and designed to support continued financial sustainability. Billing for uncompensated phone calls, for example, prescription refills, after-hours calls, would now be processed. Attract and retain current patients by being able to offer a virtual visit, save patient time, and prevent patients from leaving would increase revenue. Competing with local clinics and urgent cares would retain utilization. Reduction of no-shows, which is tied to patient copays and reimbursement, would also increase revenue. Having the ability to offer hours or after-hours services, extended hours or after-hours services from home would allow for greater access to care and increase patient volumes. Increased patient volumes would increase staff without increasing income, without adding resources. Creating revenue on existing patients, which we are not currently being paid for, is definitely a key consideration in which a telehealth program will address, specifically this one. 2 quality outcomes that we will be measuring are decreased patient wait times and increased access to care. 2 financial outcomes that we will be looking at are lower staffing expenditures and reduction in readmission rates. In looking at our plan for implementation, we're thinking of a 1 to 2 year timeline. Implementation of this program will begin second quarter of 2018, April. Statistical data will be collected on how many fast track patients wait longer than 1 hour to be seen per day in 2017. In May of 2018, we will create a business plan, and in June of 2018, we will present our plan to executives to resolve issues with increased wait times and decreased patient satisfaction related to these wait times. By August, our business plan would be approved by executives and a contract partnership develops. In October, we will entertain different vendor options for our telehealth program, and we will make a selection by month's end. In November of 2018, we will sign our contract with telehealth vendor, and ordering of equipment and a plan for installation will commence. By January of 2019, installation of the program and software will be complete. Marketing through brochures, newspaper, and radio and online advertisements will begin in February of 2019, and testing of the equipment and software occurs. March of 2019, recruitment and hiring will begin for 0.5 full-time FTEs, RN, and physician assistant. Recruitment, hiring, and onboarding will take approximately 6 to 8 weeks, and shortly thereafter we will do definite education and training. And in May and June of 2019, we will be looking at reviewing our plan and our needs assessment and perform retesting as needed to iron out any unanticipated delays. Our plan for launching our program will be tentatively scheduled for July and August of 2019, and in December 2019 and December 2020, quarterly evaluations will be performed to determine a cost-benefit analysis. For marketing, we will be establishing marketing objectives, which is increase visibility and awareness, drive internal support, drive utilization, and of course, grow our reputation. We will perform a marketing analysis to determine benefits and risk, and we would also place our efforts on target population, which is fast-track patients. And finally, we will determine what our message will be and what we would like to share through websites, newsletters, brochures, press releases, and social media. This is our brochure that we will be using. Our brochure has our logo on it, UCC Telehealth, bringing technology home for best patient outcomes. We've included our 24 access to board certified providers anytime, anywhere. We've also included our address and website, urgentcare.telehealth.org, and we've added our value statement, a value-added health benefit for our community. We've also given a little insight on telehealth and what telehealth is and how we will be providing care within minutes. We talked about what a telehealth program is on the very top, and we also indicated when telehealth should be used, when you need care right now, when you're on vacation, if you have a non-emergency condition, or if you need a short-term prescription. We also indicated our website at the bottom again, just to be able to give that information out in all areas. And then we also talked about what a telehealth program does for the community, such as decreased utilization of emergency room departments, reduces readmissions, prevents unnecessary visits, offers regional expertise to direct patients to community resources, etc. We also, at the back end of the brochure, we indicated some of our following conditions that we do treat, which are prescription refills, simple cold and flu, simple cough, rash, pink eye, minor abrasions, dental pain, minor burns, referrals, and of course follow-ups and rechecks. In summation, our proposed business plan for UCC Telehealth, we have outlined many things, such as our rationale. We've discussed how we would implement our program, our cost analysis, and of course, our quality outcomes for success. We talked about key considerations, but we also talked about how, despite the threats, we are confident that we can definitely be successful. As we venture into the future, it is important that a company remains relevant with a solid foundation. This business plan offers an opportunity for immediate success and has a strong promise into the future within the technology realm. The $400,000 financial earnings after all costs leads into our second year of this plan demonstrates secured financial stability. As we move into the future, we will have the opportunity to be the foundation for other like facilities, and that will look to try and make the same move. the opportunity afforded to us to be the first in the industry, thereby giving us credibility against the competition and a head start to last longer than the competition, would prove beneficial to both the organization and the consumer. This credibility and continued financial stability will offer us many other opportunities, such as the opportunity for constant growth to create a model that we can continue to replicate once we have had success. Our brand will lead into new ventures, such as entering the private sector and being a part of the stock exchange to have other investors help build our business. The foundation of our business plan has the potential for success and growth. We have seen new similar companies provide a practical service for investments and growth in today's world, such as Uber, Lyft, Amazon, and Starbucks. So why not telemedicine? Based upon our research and business, our opportunities for success clearly outweigh our potential threats, and our current and future society has expressed a strong interest in technology and speed to serve practical needs, and our business proposal offers both. We hope you have enjoyed our presentation, and we hope that we can work together and partner together to make this plan come to life. Thank you so much.